Is good. The next speaker is Dr. Sarah Bray, who's a project manager for the Brain Tumours Online at the University of Melbourne. Sarah Bray is an experienced research project manager and consumer engagement coordinator, passionate about science engagement with the wider community and using her research and communication skills to achieve a better, more equitable, sustainable and healthier world. Please welcome Sarah.
Thank you, Matt. It's very hard to follow a story like that. It was just so heartbreaking, and I'm really sorry that anyone in Australia still has to go through that kind of experience. Before I start my presentation, I'd also like to acknowledge the Gadigal people whose land we're on today, and also to show my support for the Uluru Statement for the Heart. I support voice, truth and treaty. I'm here to talk to you about Brain Tumours Online, which is a project that me and a whole lot of other people have been working on over the last 2 years. I'm going to start by introducing you to the project team behind it, some of the background research that led to developing it, and then explain a little bit about what Brain Tumours Online actually is, how we're planning to evaluate it, and if anyone's interested in participating, what we're asking participants to do in this evaluation phase, and I'll touch on some of the safety considerations. So as you can see from this slide, there's a lot of people behind this project. It was led by Professor Kate Drummond, who's a neurosurgeon at Royal Melbourne Hospital, but you can see that there's lots of organisations and people involved. There's researchers, clinicians, digital product designers from our industry partner Tumours, and there's a lot of community advocates, patients and carers and clinicians that have all been giving their time to this project to make sure it can be the best that it can be. It received funding from the Australian government through a medical research future fund, and that's what I'm going to talk to you about today. So research projects take a long time to do well, and this was built on almost a decade of foundational research, consumer engagement and clinical experience. This has led to this successful grant, which is to develop an online supportive care platform and to evaluate and test it. Once this is complete, the next steps will be taking on board all the feedback from the evaluation phase and then using that to improve the platform, and then hopefully by demonstrating the benefits and strengths of the platform, we'll be able to make it more sustainable, available Australia-wide, and meet everyone's needs. So some of the foundational work that this was based on was led by Kate Drummond and a trainee neurosurgeon, Heidi McAlpine. So they know that there's a lot of unmet needs in supportive care. People affected by a brain tumour face a lot of challenges, including isolation and difficulty attending in-person support groups. This is not just for people that are in regional and remote areas, but also can be a side effect of the tumour or the treatment. You might be on a seizure medication and can't drive. And also because brain tumours, there's quite a lot of different types, but they are rare, so it can be hard to find a support group that meets the needs of everyone. So that is definitely a challenge. Also, we have heard from patients and carers that finding high quality, relevant and reliable information is often very difficult. Just going to Dr. Google can be quite overwhelming, and it's very hard to determine whether the information is trustworthy or if they're pushing an agenda or if it's relevant to your situation or relevant in Australia. We know that patients and carers are turning to online supports, but there's a lot of the supports out there are not validated or evidence-based, or even when they've been produced by researchers and clinicians, they haven't been evaluated to show does it make any difference. Also, a lot of these online interventions out there didn't have any input or much input from patients and carers themselves. So Kate and Heidi asked a lot of the patients that they were seeing in their clinic what would they want from an online supportive care platform, and patients told them that they want control of access to their personal information. They wanted to be able to have flexibility of time and location, be able to log in whenever it suits them. They want an ability to filter the information and advice so that it's more relevant to them. They valued having health professionals involved to provide sort of a level of assurance that the information is correct. They also really wanted to hear what other people's experiences were, and they wanted to be able to share their experiences to help others as well. So this took us to, once we got the grant, we started building the prototype. This took us nearly 2 years because we had a strong focus on co-design and trying to make sure that patients, carers and healthcare professionals could be involved in lots of different ways throughout the project, contributing to the design, the content, preferred language and different features and usability of the site. We started with some more interviews to understand what people's needs and preferences would be on an online platform, and then we did some more detailed workshops and activities to further inform the development, the design, and get iterative feedback as we started building things. We also have a fortnightly design reference group that meets, which includes our research team, various healthcare providers, professionals, and patients and carers who come in at different times depending on their availability and interest. And they nut out all these detailed things about the platform as we're building it. To quickly give you an idea of some of the ways patients and carers have had an input in the design, they came up with the name and the logo, the illustration style, and even the colour palette of the website. All of this has led to the development of what we're calling Brain Tumours Online, which was named by patients and carers, and it focuses on 3 areas of unmet needs that can be addressed using an online platform. So we've called these 3 areas Learn, Toolbox and Connect. And so Learn lets people filter and browse evidence-based information that has been collected and put in by clinicians, so you know that it's relevant and trustworthy. The Toolbox is where you can have links to various digital health tools to help manage symptoms, and they're all validated tools. Then the Connect is more like the heart of the website, where patients and carers and healthcare professionals can connect and interact in different ways. There's a section, a bit like a blog, where people can share their personal stories. There's online Q&A webinars with different experts on various topics. There's also a social media style community where people can find other people that are going through a similar experience to them and connect at time and frequency that suits them. I'd like to show a little 4-minute video to introduce the platform, because I feel like that will be better than me just showing you lots of slides.
Welcome to Brain Tumours Online. Brain Tumours Online was co-designed by patients, carers and healthcare professionals to provide reliable information, self-care tools and a supportive community for Australians affected by brain tumours.
The idea for the site came from leading Australian brain tumour experts who saw an opportunity to improve the support available for patients, their families and friends after a brain tumour diagnosis.
Now, you may be here because you've been diagnosed with a brain tumour, or because you're caring for someone who has a brain tumour. You may be a healthcare professional looking for resources to recommend to your patients. There's something here for everyone.
We understand that everyone's experiences and needs are different. Brain Tumours Online provides information, support and connection whenever you need it.
It has been developed to help people no matter what type of tumour or how recently or long ago the tumour was diagnosed. Brain Tumours Online is the first of its kind in Australia. You can use the website to share your stories and experiences, ask questions, and let us know if there is something you want to see more information about or new features on the site.
Please let us know what you think. We really want to hear from you.
Let's get started. There are 3 main sections to the website: the Learn, Connect and Toolbox pillars. If you click on Learn, you will find a collection of trustworthy and relevant information on brain tumours from Australia and across the world in one place. You can browse by category and subcategory, or you can use the search bar to see what resources are available based on keywords. You can also filter the resources, for instance, by whether you're a patient or a carer, what type of tumour you may have, or your location, to help you narrow down the information to see if there are resources that are more specific to your needs. We have included links to other trusted websites and resources with specific information on brain tumour symptoms and treatment options, as well as practical information on managing finances and life admin, summaries of the latest relevant research, templates to help applying for the National Disability Insurance Scheme, NDIS support, and advice on having challenging conversations with children and other important people in your life. If you click on Connect, you'll be taken to the heart of Brain Tumours Online, where you can join a supportive community of patients, carers, and healthcare professionals, read other people's personal stories, or share your own experiences and tips to help others. In this section, you can also find out about online Q&A and webinar events with a range of experts to learn more about brain tumours.
The Toolbox section of the website is where we provide links to evidence-based online tools and symptom management programs that you can access from home to help address some of the challenges you may be facing. The tools will be added to the toolbox over time as they become available to use or test.
Brain Tumours Online has been developed by our team that currently includes researchers and healthcare professionals from the University of Melbourne, the Royal Melbourne Hospital, the Peter MacCallum Cancer Centre, St Vincent's Hospital, the University Hospital Geelong, along with digital platform developers Tumours and people with lived experience of brain tumours as both patients and caregivers.
You can find out more about the team at the About Us tab. While our website is not designed to replace the individualised care you receive from your doctors and treating team, it will provide you with trustworthy and up-to-date information, tools, and a supportive way to connect with others that you may find helpful. If you can't find what you're looking for, please contact us and let us know what else you would like to see added to the website. We're here to help.
Didn't work, so we don't need them. So now you've seen the video what our website looks like. We're now up to the phase of evaluating it and making sure that it is useful and meets everyone's needs. So the researchers at the Centre for Digital Transformation of Health at University of Melbourne, they developed the evaluation plan for this website, which is basically looking at, first of all, usability, because if people can't use the platform, then they're not going to use it, and if they're not using it, then they can't benefit from any of the information that's in it. So we're looking at, first of all, is the platform usable? Then do people use the platform, and what parts of the platform do they use? Whether the platform actually benefits the users. Also looking at the feasibility of whether we can deliver these symptom management tools via the platform. We're also interested in the health economic value, because in terms of trying to make this sustainable and something that's available across Australia, we hope to be able to show that it is of value and seek funding to support that. We also don't know, for instance, whether people would access more health services from using this website and finding out about things that are available that they didn't know about, or it could be the other way around, that people can find information from the website that saves them having to go and see their GP. This is the sort of thing we're going to look at in the evaluation. Who we're hoping will evaluate the website is up to 200 or 300 people who are adults who have had a diagnosis of a primary brain tumour. Also carers, they could be any family member or friend looking after someone with a primary brain tumour. Also healthcare professionals that treat or see patients with a brain tumour. Registration is now open until the end of December, and it's all online, so you can go to the website and register and go through the consent process and start accessing the website. You can use the website as much or as little as you like during the evaluation. Plus we ask you to do a few surveys and other activities to help us with the evaluation. The sorts of data that we collect and use for this evaluation include web analytics. Once you've got a login to the website, we can track your use of the website, which is going to help us figure out which parts of the website are useful, which bits people are visiting, which bits aren't so useful. Also, it will give us an idea whether people log on once or twice and then feel like they've seen enough and they don't need to log back in, or whether it's something people would keep coming back to. It gives us a lot of useful information. Then we also do a baseline and exit survey to try and find out what people's expectations for the website were at the beginning, and then at the end, whether it met any of those needs and what any feedback is. We do a whole lot of patient-reported outcome measures, like we heard from the first speaker today, where we send validated questionnaires to find out what you think are your unmet needs, your quality of life, what you expect from a health website, that sort of thing. We also do qualitative interviews with a subset of participants at the end of the 6 months to sort of drill down and ask more detailed questions than might be captured in these. And then we also collect additional data depending on how people use the platform. So if people use the tool that's to help people with insomnia and sleep difficulties, then we also send some more surveys about that. If you attend an online webinar event, then we would send a survey to find out what you thought of that and how it could be improved, or new topics that you would like to see in future. We also ask to optionally collect your de-identified Medicare and PBS data for the period of the study. If you do provide your consent for this, it's separate. It means that rather than us sending you surveys saying, how many times have you been to the GP, how many times have you been to use this healthcare service, it means that Services Australia would send us a de-identified list of the health services that you'd accessed in that time. And that helps us look at things like whether you're accessing more services because of the website potentially or not. We're also constantly open to receiving feedback from people by email or phone about things you think are missing from the site, or things that you like or don't like. So the process of participating is you would go to the website and go through the eligibility criteria, and then if you're eligible, then you can see the participant information and consent form. If you consent, then you're sent some baseline surveys, which takes around half an hour to complete, and once they're completed, then we give you an email with access to the Brain Tumours online platform. Then you can just use the site as much as you want. At 3 months and 6 months, we send you another set of email surveys. And at 4 months, we send you that optional Services Australia consent for the health economic analysis. We've tried to minimise the burden of data collection as much as possible. So wherever possible, we're collecting indirectly. So Web Analytics or Services Australia, rather than asking you a million questions about how you're using the site or health services. But there are some surveys that we do need to ask. And so we try to put them into baseline 3 months and 6 months and minimise the time it will take. They can also be saved and resumed later if you get partway through them and feel like you need a break. There's a lot of safety considerations that go into making a platform like this. Confidentiality, privacy and security are all very important. I haven't gone through all of it here today because we've only got 20 minutes, but feel free to come and talk to me if you have any questions. But basically all your health and personal information is collected via this secure platform called RedCap through the Melbourne Hospital. So anything with your health or personal information is through this system that gets stored on secure Melbourne Health servers. Everyone gets a unique ID, and so most of the people working on the project will never know who you are. They just see the data connected to this de-identified number. When we publish the results of the findings, they're also de-identified, and so you can't be identified in any of the publications. And also the Medicare and PBS data, if you consent to that, it's sent to us directly by Services Australia, just linked to the de-identified study ID. So again, it's fairly secure. The web analytics are linked to your web email address, and it's like most websites do. It's just Google Analytics. It's tracking whether people click on a certain page and at what time. There are some third-party softwares that we link to off our website. For instance, if you go to join a webinar, you would be asked to sign in via Zoom. If you want to use the social media community, that uses a Mighty Network software. If you want to use the sleep tool, that is a software from America. So all of these things are optional, and if people want to sign up and create a login with those, then they would get the same terms and conditions and privacy statements that you get when you sign up to any website, Facebook or whatever. it's important to let you know that we don't share any of your personal data with these third parties. Any data they have is what you decide to enter into them. And the last one, hopefully we've got time, is just a little bit about the community. We also had to think of a lot of considerations to make sure it's a safe space for this social media community as well. I always get a lot of questions about this, so I tried to put this slide in. So we've made access to the community limited, so someone can't really get access to it unless they've gone through the whole consent process and done the baseline surveys and accessing our whole website. Then they choose to sign up to that social media platform, and each person that requests to join it, our study team gets a notification and checks whether that's a person in our study and then lets them in. Within the actual community, there are safe spaces that we've created, which are private groups that different participants can join depending on whether they're a patient or a carer or have a particular type of tumour or a healthcare professional. And so you can have conversations with other people just with the same sort of experience as you. If you wanted to have a topic, maybe you and your family members are both members of the community and you might want to talk about something but not upset them or not know. Anyway, that's what that's there for. There's a code of conduct that everyone reads and is expected to abide by. There's an easy way to report inappropriate content to the moderators, and there's also a way to mute or hide content if it's not inappropriate but you just don't want to see that sort of thing in your feed. There's a moderation team that's based on our research team, which includes healthcare professionals, researchers, and some of our community advocates. And we meet regularly and we have a moderation guide. And they basically are there to welcome the new members, encourage positive engagement and regular posting and contributing to the community. And they also can be there to manage conflicts that arise in any kind of online forum. They can also edit and delete or caution people if needed. So that's pretty much all I had to present today. I hope you find the website useful, and if anyone would like to participate in this study to help us make it the best it can be, this is the website, and I have some flyers that I can hand out as well. Thank you.